Welcome back to OpenLine, talking about some of the legislative priorities of the Beacon Center as we move toward the legislative session next year. A lot of activity right now, this time of year, as organizations are trying to find sponsors for bills and that kind of thing. Okay, so we certainly talked about tax reform, and that's very interesting. What you're focused on as far as the Hall tax. Mm-hmm. School choice, that's another one. Another area, healthcare reform. What are some of the things you're advancing there?
Sure. So, having been opposed to Medicaid expansion gave us an opportunity to give an alternative to people, and we believe that it was our responsibility to come up with an alternative because we opposed Medicaid expansion, and so we're excited about what we have to offer in 2016 there. We'll be pushing a bill for direct primary care, and that essentially works like a gym membership does. At a very low cost, individuals can essentially contract with a primary care provider to provide all of the typical services that they would get through insurance. But this eliminates insurance altogether. So rather than allow their insurance to pay for the care that they're getting through their primary care physician, instead they contract with the physician one-on-one and pay a monthly fee like you would at a gym. And through that monthly fee, you get those defined services.
Now that's a major change.
It's a major change. It's a major shift in the way people think about how they get access to care.
Seems like it's a major shift in the way doctors think about how they get paid.
It is, and it's a concept that doctors are widely embracing. The more doctors who hear about it, the more are saying we want to go in that direction, and the more that are actually.
Would they make more money or less money?
It's really not about how much money they're making necessarily. In some cases, they don't see any change there, but it's about the headaches that they endure through having to deal with the insurance company and having the insurance company be essentially the third person in the room when they're evaluating a patient and trying to determine what's the best pathway forward for that patient. Many times their recommendations are tainted by the knowledge of knowing that they have to go through an insurance company to get authorization, or many times the type of care they would recommend isn't covered by that insurance company. So the direct primary care eliminates that concern altogether. It keeps the doctors from having to fill out paperwork endlessly that goes to these insurance companies. Instead, gives them more time to spend with their patients.
Wouldn't insurance companies hate that idea?
You would think on the outset, yes, insurance companies are going to be skeptical, and some may be opposed. But what we've seen happen in other states is that this concept is so popular. It's been embraced by virtually every state that's pushed this reform, and so insurance companies are seeing that people actually want this. It's going to be filling a bigger and bigger space in the market, and so they're wising up to that and seeing an opportunity to create a plan for those individuals so that they're Obamacare compliant, meaning that in Oklahoma, for instance, Blue Cross Blue Shield in Oklahoma saw how popular direct primary care was in that state. More and more people were choosing to go that route. But of course, if they don't have insurance, they choose to eliminate insurance, they won't be Obamacare compliant. So what a Blue Cross Blue Shield has done is create a companion plan for those people, a very low cost plan that essentially covers catastrophic care so that they can pursue direct primary care as their normal means of health care, and then have that catastrophic care provision there if they needed it. And this is all being done at such a low cost that many times it is more affordable for individuals who may have been a part of that population that would have qualified for Medicaid expansion. When you talk about the co-pays they would have had in a Medicaid plan, many times direct primary care can beat that monthly cost.
So how many other states do that? You're saying it's already passed in Oklahoma?
Yes, in Oklahoma there are 8 other states that have passed direct primary care, and there are about 12 states that are headed that direction.
So I don't see how if you pay just $40 a month directly to a doctor, I don't see how that would cover someone if they do get something like cancer or a major catastrophic sort of thing.
And that's where your catastrophic plan would come in. And at Blue Cross Blue Shield, they can offer those plans for about $40 a month. So you're talking about $80 a month in some cases. It varies a little bit, but that's about an average cost for those who have a companion plan and direct primary care. For $80 a month, that's really about what those people would be paying when you factor in co-pays and the amount that they may be paying towards their prescriptions to their insurance coverage. If it's higher, it's only slightly higher. This is a very affordable alternative to reach those who may have been pulled in through that expanded population of Medicaid. And not only does it give them a viable alternative, but it gives them actual health care. That's one thing that many times you don't hear talked about. When you heard about the debate about Medicaid expansion, you hear about, we need to provide people with coverage. Well, sure, if you provide people with coverage, those people should expect that they get health care through that coverage, but that's not what you see in Medicaid. And when 2 out of 5 doctors now moving towards 3 out of 5 doctors aren't accepting new Medicaid patients, when studies show that those who are on Medicaid have almost no measurable benefits health care wise, no measurable benefits to their health outcomes, than not being on insurance at all. We believe that people deserve a better alternative than that. People deserve actual health care, and they deserve quality care, and they deserve access to that quality care, and that's what direct primary care can provide.
So we only have about a minute left. Now, we opened the show talking about tax reform, but that is interesting, the whole health care debate. And certainly it was very emotional in the last session.
Sure.
You all opposed you opposed expansion of Insure Tennessee. What do you think about your chances for what you're talking about here, this direct primary care?
Well, legislators are very excited about it. We've been talking to a number of members. We have our sponsors in place. We've been talking with the Speaker of the House and Senate. It's going to be a very popular reform, so we're excited to bring it in 2016.
All right, we're going to take a break. We'll come back, wrap everything up. Be back right after this.